Good evening, Professor and fellow classmates. My name is Angela, and I'm going to discuss this evening why EKG should be a part of a routine health exam, hopefully to save lives, especially in cases of sudden death due to undetected heart problems. The causes of sudden cardiac death in young people vary. About 360,000 people die every year from cardiac arrest outside of the hospital. And these people are young people under the age of 35. A person can be perfectly healthy one day and then gone the next day. Many times people don't even know that they have a heart problem or abnormality in their heart. For one, today I'd like to discuss the different types of heart abnormalities that exist. For one, hypertrophic cardiomyopathy, known as HCM, is a disease in which the heart muscle becomes thick, making it harder for the heart to pump blood. It's usually not fatal in most people, but it is the most common cause of heart-related sudden death in people under 30. It's the most common cause of death in athletes, and HCM often goes undetected. The second type of heart abnormality is coronary artery abnormalities. Sometimes people are born with heart arteries that are not connected normally. The arteries become compressed during exercise and they may not provide proper blood flow to the heart. That's another type of heart abnormality. Another one is called long QT syndrome. Long QT syndrome is an inherited heart rhythm disorder that can cause fast and chaotic heartbeats. The heartbeats caused by changes in the heart that causes it to beat may lead to fainting. These irregular heartbeats can be life-threatening. In some cases, your heartbeats may be so erratic that it can cause sudden death. Young people with long QT syndrome have an increased risk of sudden death. Many times these deaths occur without warning, but symptoms to watch for is the fainting, especially during exercise. If you faint during exercise, could mean that there is a problem with your heart, and also family history about sudden heart death. If you have that history in your family, you should definitely get that checked or bring it to the doctor's attention because it could be inherited. So in summary, if someone in your family dies young, it's important that an autopsy is done to determine the cause of death. If the autopsy shows that there is a heart condition that caused the death, family members should be screened, especially if it deals with hypertrophic cardiomyopathy. It's definitely recommended that mother, father, sisters, brothers, and children of the deceased be tested. According to the American Heart Association, death statistics indicate that age 35 is the turning point in increased risk of sudden death in American men. This topic was of interest to me because my husband did pass away at the age of 35 due to a sudden heart attack. He was 6'2", 280 pounds of muscle, very healthy. He ate well. He seemed very healthy. He didn't go to the doctor regularly, but we would never expect that he had a heart condition. After his death, the autopsy did show that his heart was 3 times the size of a normal heart. He was at high risk of this happening to him, and we didn't even know it. He did complain of his arm being numb and his left shoulder hurting many times, which after his death, we know that that is a sign of also a heart condition. I hope that listening to the speech, we can all make time to go to the doctor. If you experience any unexplained chest pains or shortness of breath, irregular heartbeats, that you bring it to the doctor's attention so that tests can be done. So I think EKGs are very important. We should definitely ask for them at the time of exams if you do feel that you need them. They are very inexpensive and it could be done in a matter of minutes. So thank you.